Good afternoon and welcome to today's webinar focused on healthcare informatics. This webinar is hosted by Jones and Bartlett Learning in conjunction with two of our esteemed authors and experts on the topic, Dr. Dee McGonigle and Dr. Kathleen Mastrian. So just a little bit about our presenters today. Dr. Dee McGonigle is currently a professor in the graduate program at Chamberlain College of Nursing. She's also the director of virtual learning experiences in the Center for Transformational Education and Learning Innovation at Chamberlain University. Dee is also a member of the Informatics Technology Expert Panel, ITEP, for the American Academy of Nursing as well. So she's very busy. And Dr. Kathleen Mastrian, she's the professor emerita at the Pennsylvania State University College of Nursing, and she's also the senior managing editor for the online Journal of Nursing Informatics. Two very busy women. I want to welcome you both. And at this point, I'm going to turn the presentation over to Kathy. Please go ahead.
Okay, I'll give everyone a moment to read the ANA definition of nursing informatics, and then I'll speak to some of the key points within that definition. You'll notice that we have highlighted several phrases within the definition. And I'd like to specifically call your attention to identify, define, manage, and communicate data, information, knowledge, and wisdom in nursing practice. This is really a key component of all of informatics. The idea of data, information, knowledge, and wisdom, or typically this is referred to as the DIKW paradigm. In addition, we have emphasized the idea of decision-making in all roles for achieving desired outcomes. And so what we'll talk about throughout the presentation as we're making the case for all health professionals need informatics education, we will be talking about how informatics does support decision-making and helps us to get to what we want as outcomes for our patients or our desired outcomes. And then finally, we make the point here that information structures, information processes, and information technology are the things that are integral to nursing informatics. Here, we're making a point about health informatics being the specialty that integrates concepts from disciplinary science. Now, obviously for nursing, the disciplinary science is nursing, but we also have computer science, information science, and the cognitive sciences. And again, to manage and communicate data, information, knowledge, and wisdom for delivering healthcare. So again, you see that DIKW very clearly highlighted in this definition as well. All health professionals use informatics within the scope of their discipline. For example, you may not know this, but there are professional informatics groups for dentistry, for nutrition, for physical therapy, for occupational therapy, for radiology. So informatics is definitely a key component of all of those disciplines. Our sister textbook, the one that's not the nursing informatics book, our sister textbook is designed for other health professionals. But I really would like to make the point, and I think it's critically important, that nursing informatics courses really should use the nursing specific text, because all of the discipline of nursing science is also included within those discussions and all of the lessons and concepts that are contained therein. Dee, do you have anything to add?
Oh, no, not yet.
Okay, all right. All right, so studying informatics helps healthcare professionals identify themselves as knowledge workers. Now, you may not think of yourself as a knowledge worker, but you are. As a faculty member, you are a knowledge worker. Nurses do not often think of themselves as a knowledge worker, but whoever works with data, information, generating knowledge as a byproduct is a knowledge worker. And again, you can see that DIKW paradigm very much front and center here in this discussion. All of the various nursing roles, practice, administration, education, research, and even the specialty of informatics, all of those involve the science of nursing. Nurses acquire knowledge, so they're important to think about convenient and efficient means of how they can capture and store knowledge. And of course, some of our technological tools have helped us do that much more efficiently now. Nurses are also knowledge users, and they benefit from valuable and viable knowledge. And probably you have experienced logging into an information system and you didn't get the information that you thought was going to be there, or it was in a format other than what you expected. So it's critically important that that nurses are verbal and vocal about how we can improve these processes and these technologies. Nurses are also knowledge engineers. They're people who design, develop, implement, and maintain knowledge. Nurses are also knowledge managers because you capture and collect expertise and you distribute it to the greatest benefit. And finally, nurses are knowledge developers or developers or generators of knowledge. I'm so stumbling over those big words there. People who change and evolve knowledge based on the tasks at hand and the information available. So studying informatics then helps nurses see and identify themselves as knowledge workers.
We are working in an exciting time in informatics. We have data-driven solutions that are providing us with insights into our patients. We leverage this data to develop workflows that will enhance patient engagement, improve the quality of our care, and improve our patients' outcomes. Some examples of these tools include artificial intelligence, machine learning, and robotics. Artificial intelligence, we talk about the machines being programmed to think, work, and react like us, like humans. Machine learning, though, is actually a subset of artificial intelligence and one way to realize AI or artificial intelligence. Machine learning is the science of training devices or software to perform a task and improve its capabilities over time. So it's actually learning from the data and information it is generating. Robotics, on the other hand, is an interdisciplinary field integrating computer science and engineering to design, build, and use robots. Robots, of course, are machines that work by themselves, following a set of programmed rules. They might not be smart, so they might not have any artificial intelligence. Some robots are programmed to perform repetitive tasks over and over again without any intelligence at all built in, so they're not smart. Data processing and predictive analytics is how we use AI and machines to improve patient care and overall population health by assessing social determinants of health data, using advanced analytics, and to determine potential health risks. Another tool we used, and one that I really like to see being used, is data visualization, so that we are able to take huge amounts of data and communicate or disseminate it in a visual context. So we can see it in clusters, bar graphs, line graphs, pie charts, what have you. It's all transforming the healthcare industry, and it's critical for everyone in healthcare, all healthcare professionals, to be able to interface with the databases and generate pictures of data that allow them to visually review patient information, patterns, and trends. Kathy, do you have anything to add?
No, that was great.
Boy, thanks.
Okay, and another reason to study informatics and include informatics content in all healthcare curricula is that informatics tools ensure patient safety. Now, we are all aware of the national goals for patient safety, and these are ongoing. We do recognize that healthcare is inherently an unsafe environment, and so we need tools at our fingertips to help us maintain safety. So there are numerous safety tools that are technology-based, from things like computer CPOE, or the provider order entry, decision support tools, BACMA for medication administration, smart pumps, clinical decision support systems with clinical alerts, handoff tools and technologies, automated dispensing cabinets, again, robotics, as Dee mentioned, and some of the newer electronic health records actually have what is known as bidirectional interoperability. And what that means is that the EHR is actually able to pre-program a smart pump for high hazard drug infusions, rather than relying just on the expertise of the technician or the nurse who is setting up the smart pump. The EHR with bidirectional interoperability actually pre-programs the smart pump. Now, those do have to still be checked by a human, but it is critically important to see how these tools, these technology tools, could actually promote patient safety. Now, Dee was talking about artificial intelligence. In this case, because there is a human who must double check what's happening with the pump and make sure that it's been programmed appropriately, that is a way, I think we refer to then as augmented intelligence. In addition, informatics tools are used to track and analyze safety issues and near misses. So the idea is you don't want the same error happening over and over and over again, but if you can track it, and especially near misses where no harm occurred, if you can track it and analyze that data and put that data in a shareable database detailing what happened, how it happened, and how they were resolved, then in that way we can share our learning based on patient safety. Many of the informatics tools depend on cognitive informatics and human factors engineering concepts. In other words, we want to build tools that people are likely to use. There's no point in building a tool that stresses the user out so much or overwhelms them cognitively that they're unlikely to use the tools. So we really want to build tools using cognitive informatics and human factors engineering concepts so that the tools will be used appropriately and will perform as intended. Now, you're all familiar with such issues like alarm fatigue and procedural workarounds. Now, these are very, very dangerous for patient safety. And the reason that these happen, procedural workarounds happen, is when technology actually interferes with nursing workflow. So that's another key concept in informatics, is the whole idea of paying attention to workflow and also quality process improvements. And nursing informatics study then helps us to understand, how can we improve these processes? How can we improve the technologies to support the clinical work? Dee, anything to add?
No, I think that was great, a great recap, and somewhat it reminds me of the EHRs that were lockstepped. And now we're getting away from that, thank goodness, because we were trying to increase safety. So people had to go through all these screens to make sure they checked the allergies, they checked for sepsis, et cetera. But they couldn't get where they needed to go. So, we are really moving forward with the patient safety. And this is real interesting to me always, because just as we're targeted in our personal lives based on an analysis of our buying patterns or the TV channel choices we make, we also are learning from those same marketers personalizing ways to personalize our patient portals so that we can look at it being based on the specific needs of the patient and help to engage them. We hope that once we get them engaged, they'll return and interact if they feel that their needs are able to be met. You know, whether it's being able to extract appropriate information or informational materials, whether it's to contact their provider or access even their current lab results. We want our patients to be engaged and actively participate in their care. You know, I love the apps that we're prescribing, because as more and more apps are being prescribed, we're actually seeing patients use the apps to monitor themselves and to better care for their own health. Anything to add, Kath?
Yeah, I have a portal story to share. I was quite excited to have received my COVID vaccine, and I wanted to upload a copy of my vaccine card to the portal in the message body to my PCP office. Well, guess what? It won't accept a picture. Which could be, and so that's critically important, because if you're talking about using apps, and you could screen capture something that an app has pointed out to you in your, you know, if your, maybe it's your heart rate or whatever, it would be nice if those screen captures could also be shared with the PCPs. So maybe that's something to look for in the future. So when we get our much more sophisticated types of tools, that we can be able to do that.
All right, and you don't want to frustrate patients. You wanted to get in there, you wanted to upload that, you wanted your PCP to know that happened, you know, and all on your chart, and you couldn't do that. So we're trying to avoid, you know, frustration while we engage patients, and we want them to share information. So just like that, we put a roadblock up.
Right, right. Okay, next. So another thing to think about in terms of informatics tools is that these tools do support population health. And certainly never has this been more apparent than our last year, in the sense of the tools that are evolving, popping up almost immediately, almost every day, as a result of the global health crisis. But even leading up to that, you know, in the last 2 decades, we've had SARS and MERS and Ebola and H1N1 and Zika, and then finally, you know, COVID-19. So it's critically important that our national, local, and international response folks are able to use informatics tools to collect and analyze and validate and efficiently exchange information. Now, it's interesting because COVID-19 also forced disparate systems with non-interoperable processes and data management, forced them to streamline and coordinate data collection and analysis so that information could be shared seamlessly and quickly. This semantic interoperability and secure data exchange, these are very important tools in informatics. These have been promoted and embraced. Now, just as an aside, if we're talking about things and putting out concepts and words that are not familiar to you, it's very important that students, every student in an informatics course, is being exposed to these concepts. Now, are they going to write programs? No. Are they going to develop apps? Probably not. Are they going to design a health information exchange? No. But if they understand how these things work and they can embrace the technology, then we really can go a long way toward promoting population health management. You probably also noticed that telehealth increased dramatically during the COVID-19 pandemic, and it'll be interesting to see whether that trend continues in the future. I can tell you, I had my mother, who resides in a nursing home. I had her cardiologist do a telehealth visit with her, because it didn't make any sense to me to pull her out of the nursing home, expose her to what God knows what in the office waiting rooms, and also she would have to quarantine when she went back to her home. Didn't make any sense. She was stable. Let's do our telehealth visit for right now. And that worked out, you know, actually quite well. So as a result of the continued learning that's been prompted by the COVID-19 pandemic, we can expect to see even more knowledge tools in electronic health records being developed and shared in the near future. Now, we do talk about one such tool. It was I believe it was a hospital in New York, and what they were doing was, as you know, much of what we did very early in the pandemic, we were learning on the fly, literally flying by the seat of our pants. What works? What doesn't work? What position should we put people in? What kind of support should we give them? Well, these folks were writing protocol right within their electronic health records that they were willing to share with other institutions, which is critically important, because if you tried this and it didn't work, it's nice for the guy down the street to know that we tried that and it didn't work. And it's a way of really moving the population health forward, relatively quickly.
And I think you bring up a really great point too, Kath. COVID made people have to do things. So
That's right.
on the education side, it made people look at virtual simulation and virtual ways to reach out to their students and educate them. And on the provider side, it did the same thing. How can they meet with their patients? How can they deal with this? How can they disseminate what they're finding? So I think it really did a lot to push people forward who were timid, if you will, and not ready to put their toes in the water, but I think it gave them the push.
Absolutely.
IPE, or interprofessional education, is critical for us when we think about the preparation of our future healthcare professionals. Since the interfacing of health information and health informatics technology and interprofessional collaborative practice can actually transform what we're doing in the healthcare delivery system and how we're taking care of our patients. Just as we need IPE teams in the healthcare delivery system, we also need them in the educational delivery side. So we have to have IPE content and practice available to our students. The health informatics specialist must be included on the IPE team. We can use tools such as meeting tools such as Teams or WebEx through virtual worlds to facilitate the IPE episodes. It's also essential to provide cloud-based or learning management system access to the IPE tools in order to truly promote in our students interprofessional collaborative practice. Informatics education helps students build the confidence to have a voice. And that voice is so important because we want them to have a voice when they enter the workforce. We need healthcare professionals to challenge the IT tools they're provided with, especially doing for their workflows, such as the EHR and smart pump, smart tools. They must be able to provide guidance as to how to improve these products instead of creating the unsafe workarounds. So in addition, they must be able to contribute to the development and implementation of these new tools that not only enhance each profession, but also improve the quality of the care we provide to our patients. In one clinic, the health professionals, led by a colleague who was in his master's, was finishing his master's degree and taking his second informatics course, determined that they could develop their own homegrown EHR that was customized to meet their practice needs. They met with IT and they laid everything out. They were very clear in their objective, and they also spelled out for IT the issues with the current system, which is huge because IT typically they build it, but they might never use it or see it after that. So it's huge that we point those things out to them. In 6 months, they built, tested, implemented their own EHR. It did take an entire village, but they now have a functional EHR. And I bet you if they could put it on the market, they might even compete with their old vendor. But it takes us all to realize we have to have a voice, though. If something's not working for us in our workflow and how we're dealing with these digital tools, we need to be able to not just complain about it, but to outline a path to come to some resolution for it.
Okay, so informatics education actually prepares nurses for 21st century practice. In addition to the basic technology skills, preparing students to function in our practice settings, including things like EHRs and safety technologies, informatics education also introduces nurses to things like network integrity and security. Now, this is critically important to anyone who is accessing any kind of digital tool on a network. You must understand basic concepts of how networks get hacked, how phishing occurs, and people fall for phishing schemes and scams. It's very, very important that students are at least exposed to this. Now, are they going to actually build security tools? No, but if they understand bits about integrity and security, they can be aware when there is a threat to their network and perhaps be the person who reports that that someone was attempting to get into the network through them. Informatics also looks at ethics related to managing private information, and this is critically important, obviously, to anybody who is accessing private information. And then finally, pertinent legislation related to technology integration in the work setting is also very much covered in an informatics educational curriculum. We also discuss things like social media for nurse continuing education and professional collaboration. You can really do a great job of collaborating via social media. However, there are potential pitfalls of personal social media use. And again, it gets back to that ethics and the legislation that we were talking about managing private information. As our patients get savvier and our technology expands, we must be willing to embrace the kinds of things that people are interested in. For example, your patients might bring to you, they want you to take a look at their Garmin smartwatch, and they're not quite sure how to get their blood pressure to record on this. Or they may have purchased the app where they can take their own EKGs on their cell phone. So we need to be at least savvy enough, exposed enough that we're not intimidated by these tools, so that we can really embrace things like care robots, smart rooms, smart fabrics, as well as the many wearables that assist in monitoring overall health and overall fitness. We can also expect to see much more interoperable electronic health records and HIEs. We know now that we cannot afford data silos. We must share innovations as they occur, and we must be willing to help others, embrace those innovations as well. Okay, Jen, there we go.
We wanted to just include the textbook resources. The first one, Nursing Informatics and the Foundation of Knowledge, is intended for the nursing discipline. And then the Informatics for Health Professionals is intended for health professionals. And we have many examples of discipline-specific informatics contained within there as well. Did you want to add anything to that, Kathy?
No, just again, I've had people reach out to me and say that they were using the Informatics for Health Professionals in a nursing curricula, and I would suggest that you look very carefully at that, because it is critically important to have the nursing discipline specific information at your fingertips within the nursing informatics textbook. So I would suggest that you take a look at the nursing informatics book.
Thank you. This slide provides a reminder that in informatics, we must always think of several things: our discipline and how informatics is shaping and enhancing our practice. We must consider the pathway or dynamic continuum that we progress through to complete the puzzle of our patient by gathering, assessing, and disseminating data, information, and knowledge, while we add to our knowledge base and our expertise to develop our wisdom. We must also reflect on ways that we can promote and enhance cross-discipline EHRs that help formulate the complete picture of our patient in order to provide quality care that results in the best possible patient outcomes. And finally, artificial intelligence, AI. We need to look at AI and how we can collaborate with our ever increasingly smart technology counterparts to improve patient care.
Again, I'll just point out again, the DIKW is so critically important to embrace. And on the slide on the far right-hand side is actually a graphic from the book that takes you from data, information, knowledge, wisdom, up through change. Okay, and it's important that students get excited about DIKW and identify themselves as knowledge workers.
I agree, Kath. It's critical that we collaborate with our healthcare consumers. They must be engaged in their healthcare, so we are responsible for enhancing their knowledge or their current situational context, but also promoting their well-being by decreasing patient risks. The other area that needs our attention, as Kathy addressed before, are the wearables that patients are using. Again, as she stated, we have to be astute about what they are, and not only what they provide for the patient, but what they provide to us as the healthcare team managing that patient. Wearables provide copious amounts of data and information, and we must remain steadfast in our ability to not only secure, monitor, and track that data that's transmitted to us.
Actually, my Garmin is telling me I've been sitting too long, telling me to get up and move.
Are you an overachiever? Do you get more than 10,000 steps?
Oh no, I wish I did, but no, not when it's cold outside.
I love those terms. You're an overachiever.
When golf season comes, that's a different story. Yeah.
Oh,
But no, I think it's very interesting how many people are embracing wearables. And I get a lot of questions about them. A lot of people will ask, well, how do I do this or what should I do? And most of them are pretty intuitive. If you've seen one, you've basically seen them all in the sense of how they work. And, not being afraid to touch a touch screen or push a button. And that's what informatics does for people. It takes away all of the mystery of technology so that they are more comfortable in discussing this with patients.
right, and the connection from the wearables as well, because in some of the medication systems apps, they actually have a person who's your safe person, so that that person is also reached out to, and it might be a neighbor or whoever. So it's really interesting that it's not only telling you what time to take your med, but it's also reaching out to someone else who you've identified, telling them that you have not taken that med yet, and that you that. So there's so much coming out with all of that. And again, it goes back to security issues, and people are concerned where that data goes. So we have some work to do in the education piece.
Right. My son was a little bit surprised when he got I didn't realize they would send him a text message telling him that he'd been added as an emergency contact on my Garmin. But my Garmin has an altimeter. So if I fall down, if it senses a fall, and if I push a button and hold it for 3 seconds, it will automatically go to this emergency screen. Now I can cancel that. I think I've got 30 seconds to cancel that in case I don't need help. But he said, well, why did you pick me? And I said, well, first of all, your dad might not answer his phone and he might not know what to do when the GPS tells him where I'm located. But you have to be willing to, mine tracks me. I get in the car and turn the ignition on and it says, oh, it'll take you 15 minutes to get to Seneca Road. Well, okay, I'm not going there right now, but okay, thanks.
And well, we know some of them need a little bit more work.
Mm-hmm. Yeah, and the robotics are really fun nowadays. My mom has a robotic dog who responds to, if you touch the dog, it will whimper and move its head and open its eyes. It will bark. It's the coolest thing ever, and she absolutely loves it. She talks to it. She puts it on her lap. You know, it's just a little something. And honestly, she got her name for it is PT, poor thing, but it's really kind of cute, and I like it too. So I'm looking into they are also, you know, care robots that you can get for your home that will do things like remind you to take your medications, to call for assistance if you fall down, those kinds of things. So very interesting.
It's an interesting time we're in.
It is.
Informatics education continues to need administrators who understand its importance. And coming to this, we really need the buy-in. We need those administrators willing to say, this is important. And for all the things we've been talking about, I hope it's coming to the forefront. Many executive track and administrative programs now are including informatics in the last 10 years, which has been awesome, because now we have administrators who are starting to understand the need for informatics. So we want them to buy in, we want them to support the programmatic needs. And that means that it's not only what's needed for coursework, but it's also for any tracks that might be wanting to be built in informatics, or even programs of study in informatics. The other thing they have to buy into and really push for is hiring the appropriate faculty to teach the informatics courses. And faculty experts are always needed to provide accurate, timely information about informatics. It's also those faculty who will spearhead the need to have informatics courses in the curriculums in all levels of healthcare education. So we need the buy-in from the administrators, and we also need expert faculty out there who are really saying why informatics is important, why it's needed, and pushing for its inclusion, and not to be kind of passed over or put as a thread that is ignored in some courses where faculty aren't as comfortable with informatics. Kathy, do you have anything to add?
No, that's a really important point to make, is that it is important for the right person to be teaching these courses. Now, that doesn't mean that someone can't learn the content, because you certainly can. But it is important to have administration buy-in. And just for example, the gal who reached out to me about developing the course, or that she was developing, her administrator was forcing her to use the health informatics book rather than the nursing informatics book.
Wow.
Yeah.
Oh, well.
Yeah.
So much for administrator buy-in there, but
Right. Yeah, for
other
sure.
places. Career readiness, career readiness demonstrates the academic and technical skills necessary to join the healthcare workforce. Health professionals must understand their role as knowledge workers, and they must be career ready when they enter the workforce. We must provide our students with the ability to apply theory, high-level problem solving, clinical judgment, and critical thinking skills to the role that they're preparing for. They must experience real-world applications with health information technology. So our graduates understand the importance of informatics and technology, and add insight to inform their role enactment in the technology-laden healthcare arena.
Boy, isn't that the truth? So I think we did emphasize the need for, if you are in the discipline of nursing, using the nursing textbook, or embracing that, because it does give you the nursing discipline aspect, where the other book is much more generalized in terms of disciplinary science. We need not be afraid of technology, which is a critically important final thought to think about. We need to embrace it. And certainly, if you just spend a little bit of time thinking about the technology that made a difference in the COVID-19 pandemic. Never before has it been clear as it is now.
Those are great points. And I want everyone to have a voice. Don't be hesitant to say that something isn't working as it should and that their changes need to be made, because it's the people who are using the tools that are being made who need to be able to express whether or not they're working well. So we all want, in the end, we all want wonderful patient care, quality patient care, and terrific outcomes for all of our patients. And I think we can get there if we all work together and are not afraid to raise questions.
Mhm. Okay, Jen, we'll turn it back to you with questions.
Great. Yes. Thanks, Dee. Thanks, Kathy. I think that was a really interesting dialogue about informatics. We got some great questions that came in. Before we get to those, you have the opportunity to contact Dee and Kathy directly. They were kind enough to be able to relay their email addresses if you would like to follow up with them regarding questions. So our first question is regarding hacking and the cybersecurity issues that might come with the use of artificial intelligence and other informatics tools. You know, lately we're hearing about hackers really targeting healthcare systems and wanting to get their hands on healthcare data. So if you could speak to that, I think that would help address the question.
Sure. One of the most common ways that hackers get into a system is by sending a phishing email, and they convince the person who receives the email to inappropriately click on a link. And as soon as you click on that link, you're done. Critically important to be paying attention to. Did you expect to get the email? Is it from someone that you are familiar with? If it gives you even a second's pause, I wouldn't do anything with it. I wouldn't click on it. I wouldn't do anything. Critically important to think about. The other thing that happens is, you know, we carry laptops out to home visits and so forth, and a lot of those are equipped with wiping technology. But anytime a hacker can get into a system, and you've probably seen the most recent ransomware issues that people have experienced in the hospitals, where they actually tie up the total system until someone's willing to pay the ransom to unlock all those systems, and it's absolutely horrendous. Which is why, as Dee was talking about, cloud computing is useful, where you have a lot of your things backed up in the cloud, and you know, you have a lot more safeguards available. But most of the time, it's an insider who makes a mistake. Now there are malicious insiders, but we hope there aren't anybody that we work with. But you know, sometimes it is an insider who makes the error and allows access, inappropriate access to a network.
And in artificial intelligence, I know people have raised questions about the initial programming of that AI agent, if you will, and if it could be corrupted in the beginning. And as you know, artificial intelligence agents can have babies, so they can produce models of themselves or subsets of themselves. And so some people say they're having babies, and they're creating that at such a speed that humans can't keep up, because we can't check the code as fast as they can create it. So there have been some people questioning whether or not there could be an artificial intelligence issue based on programming or something that is malicious that's added to that code.
Thank you. A couple of other questions came in, and I think someone has a question, I think, regarding the first part of the presentation when we were talking about apps and uploading pictures through the patient portal. There was
Yes.
just a little bit of a phrase, so maybe you can kind of pick it up from there. Hopefully I got the gist of it.
Oh, just the difficulty. All I was saying is, if I were creating this portal, I would make it so that I could send screenshots or send photos to my PCP. For example, I sometimes will get a rash for no reason. So would be really nice to be able to send that photo through the portal to the PCP. But the one that he has is pretty basic, so it doesn't allow for that to happen.
And I also think too, we need to be thinking about the formatting of those pics, those images, and what's typical for our patients to have so that we make sure our portals and other access means they provide for those formats to be handled easily so that we don't frustrate the patients.
Mm-hmm. I don't know,
Great.
maybe my PCP would say it's too much information. He doesn't want that.
Well, can they tie it to payment? See, there's the other problem, right? If they
Right,
can't tie everything to payment, it's
right.
that's another issue.
But some of that is going to change, and some of it has changed actually with telehealth.
Yes.
The revision of some of these payment, and I think so more and more physicians are going to be asking for this, and healthcare workers are going to be asking for this.
We have another faculty asking about IPE simulations, stating that she's very interested in IPE simulations. And what ideas do you have for incorporating informatics systems experiential learning during an IPE simulation with nursing students and with graduate healthcare providers, such as NPs, CNSs, PAs, et cetera?
And that's a loaded question. That's a good one.
Woohoo! That is a good one.
Just to start with, first of all, you need to know what kind of tools you have available to you to use. So some programs are very, very, I wouldn't say low level, I hate to say that, but they're starting with just a meeting base. So the people might meet in teams. They might meet, they might be provided with a scenario even digitally, like in a Word document that they have to work through, and then they meet in teams to work through it. So that's one way you can get in with very minimal costs and very easy to start. You can go all the way through to a virtual sim lab where everyone can go in multiplayer and deal with that patient avatar at the same time, and it's very controlled. And so that you can work that patient through whether or not they improve or whether or not they go downhill. And you can set that all together and see how that healthcare team works, almost similar to a regular sim lab on ground. So that they can work through that. So they go through all that and then they debrief as well. Some are doing the very interesting introductory preparations before they even get to see a patient or react as far as a team to patient care, where they switch roles. And so they try to learn about the other person's discipline and what it means to be that person on the healthcare management team in relation to patient care versus what their role is, so that they can start to see the other person's side of the coin, if you will, or the healthcare situation. So there's many ways to get started that don't cost a lot of money. If you have software though that will allow you to do multiplayer where people can get in together as avatars, that's terrific because it's there, it's working just as if it was, if you were in the healthcare team. But other people have made it work very well just using the Teams meetings or WebEx or whatever you have available to you, and having the team get together that way. I hope I answered that question.
I think you did. I think you did a great job. I was thinking, boy, we shouldn't have put up pictures of ourselves. We should have put up avatars.
Yeah, right. My avatar is gorgeous because all the avatars are really, unless you age them, they're really young and low. They look great. So unless you put some time into aging yourself, and
Oh, that's funny.
The
Any
questions
other?
keep coming in, so we've got a
Okay.
bunch, which is great. Another faculty member is saying, as a simulation director and a chair of an informatics committee, how can she encourage faculty to improve their informatics knowledge at the undergrad and grad level, saying that she has many timid professors?
Mm. Well, there are plenty of opportunities for informatics learning. I'd start with a boot camp, somewhere where you go to a retreat or a 3-day seminar and just kind of get your feet wet, sort of thing. You could sponsor a seminar at your place of learning and invite an expert in there to do that.
And I agree. I think there's a lot of things that can be done. The other thing is, we have to give people, we have to give everyone the voice. Sometimes it's our faculty that don't have the voice, or they don't have the understanding, and they're afraid of showing someone that they don't know. And that's really critical that we get past that they do learn what informatics is. And sometimes it's as easy as putting together a quick PowerPoint and sharing it with everyone. We had someone put PowerPoint slides ongoing in a lunchroom, if you will, on a campus. So that where the faculty came in a lot, they had those slides just constantly going, and people were starting to feel a little more comfortable with terminology and what it meant, and how you could do it at that campus, because they talked about specific tools. So that really worked well, because again, it's putting it together for them so that they know, they kind of have an understanding and a foothold where they can ask questions and think about where they need to go.
Mhm. Thank you. I'm going to combine this next question into two questions, but they're actually separate. So we have two different faculty members asking about the expectation for the level of knowledge that undergraduate students should have. One, with respect to informatics and how it should be incorporated into a BSN level curriculum. And then secondarily, how much should undergraduates be informed about AI?
Well, I think I would certainly refer to the baccalaureate essentials. There is a whole section on informatics. So that's what I would defer to in the sense of, these are the critical get your feet on the ground, get started kinds of competencies. But also take a look at what your employers are requiring and expecting. What do they want people to be able to see and do and be comfortable with? That's critically important as well.
And I think we do have to take, that's a great point, Kath, because I think we do have to take from, the actual workers and the actual practice setting, because, we know in practice settings, we're using virtual reality. I mean, it's there for our patients. We're using virtual reality on their own anatomies before we do surgery on them. So surgeons can practice, on the patient's own anatomy before they do the actual operation. So there's so many things, and artificial intelligence is becoming so mainstream, especially with the question of, are we going to have radiologists in, 5-10 years? There might not be any radiologists because AI can read the x-rays and interpret them.
Mhm.
So,
Right.
with all of that happening, I think we have to stay ahead of that for our students, because we want them to be able to come out into the healthcare workforce and feel comfortable with anything they're seeing in patient care.
Right. And don't be afraid of AI. It doesn't have to be a big fancy kind of thing. I mean, the wearable technology here uses AI to tell me when I get in the car and turn it on how long it takes to get to Seneca Road, because it's learned my behavior. Okay, so it's not necessarily something that is so sophisticated that we couldn't possibly embrace it or understand it. That's not the case.
And chatbots that are at a lot of
Sure.
universities, to help the students, those have AI in them. So,
Mhm.
it's those kinds of things that we need to point out to the students as well. Well, you know what? When you come back and your computer says something that your husband searched for, or your wife searched for, or your friend or whoever, and
Right.
it comes to your computer because you're using the same network, how'd that happen? How does
Yeah.
Alexa answer your question, Siri? So I think we need to bring it back to what they normally see in their personal lives, and then pull it to, okay, what do we see in practice now? Or how could that be used in practice?
Great. Couple more questions that have come in. One pertains to some content in the book, so I might just combine them. The first is respiratory therapy covered in the healthcare professionals text related to informatics? And then secondly, are there any plans to write or publish a text on healthcare workflow analysis and redesign?
Well, there is a chapter on workflow analysis and quality improvement in the nursing informatics book. Um, So yeah, that is included for sure. As far as specifically respiratory therapy, it's certainly mentioned, but there's no disciplinary content for respiratory therapy. But certainly the general concepts of informatics can be applied to respiratory therapy. I hope that answers the question.
I think so.
Yeah, great. Um, we have another faculty member who was asking about focusing on what would your informatics message be overall to people who are already in the profession. Would that messaging be any different, or how would you message or reach people who are already practicing?
Well, I think
And what
the
would your
folks,
focus be?
the folks who are already practicing, I would highly encourage you to get certified in informatics, and to join one or more of the informatics work groups, things like HIMSS, or there are several of them out there. The other name is escaping me just now, but you know, what's one way to stay in touch with other informatics specialists. Our textbook even though it covers or could be used even in a graduate program, um, it is not a specialty textbook for informatics, so to speak. It's for getting the first exposure through getting you prepared to utilize informatics in a clinical setting.
Well, and I think too, you need to think about, do you have an informaticist where you work? Do you know anyone who is in informatics? You know, I've had people tell me, boy, I went around with the nurse informaticist for a day and was my eyes open. I didn't know what they did. And, you know, so typically the informaticist is a liaison between IT and nursing as well, or whatever discipline you have. So it's not just nursing, but it's any healthcare discipline if you have an informaticist present. So you might want to start there and look and see if you have an informaticist you can shadow or even discuss, you know, what you need to know at your level, and volunteer to help, volunteer to be on those committees.
Oh, absolutely.
And then the last question that we had was from someone saying that they have some conference dollars, they have some, it looks like maybe some budget, and was wondering for what you had for recommendations for how to put that budget toward creating those informatic boot camps that you were referring to a little bit earlier in the Q&A.
Well, actually, I think informatics boot camp might even be trademarked. It is something that's already ongoing. But there are plenty of actually, I believe it's chapter 6 in the informatics nursing informatics 5th edition. It talks very specifically about some of the programs that are available around the country, and also some certificate programs for informatics. Penn State, for example, has a nursing informatics certificate program. Now, that's not certification; it's a certificate program. In other words, it's content that is specific for informatics. Dee, I believe Chamberlain has something similar.
Right. And if you think about Maryland, they have the informatics conference every year in Baltimore. Trying to think of the ones that you could think to go to. You might even want to spend those monies on having someone come to you, though, and specifically work with your own faculty or yourself. So, you know, you might want to think about that, or see if you can, you know, attend any conference that's on informatics.
No, the HIMSS conference is amazing.
Yes. Oh my goodness.
Yeah, my goodness, it's miles and miles of vendors. Well, it used to be. It was virtual this past year, but to see some of the new technologies and miles of vendors and people that you can interact with and talk to, and you know, session after session of really good content. So I would suggest that. I know in Philadelphia, I think it's Drexel has quite a few virtual kinds of interactive sessions as well. If you've never done a HIMSS conference, it's worth doing one time. It's not cheap, but it is worth doing one time because it is astounding what's going on out there.
And the networking is
Yes,
really amazing.
huge, huge. Mm-hmm.
Great. I know we have a couple of comments that have come in from folks just letting you know about some other boot camps in their area. Someone saying the University of Minnesota also has the Nursing Knowledge Big Data Science meeting every summer.
Yes, they
actually,
do.
two people commented on that. And I think someone was just wondering, the HIMSS conference, is it HIMSS? Are those,
Yes.
is that the acronym? Okay. So I know someone just wanted to Google that. And what's the full name?
Health
Kathleen?
Informatics Management Systems Society.
Great. Just for people that might be unfamiliar with that. Excellent. Thank you.
And the other thing is there is the Online Journal of Nursing Informatics, which Dee founded actually, and I am the senior managing editor for. So you can get plenty of interesting informatics articles there. There's also a Canadian Journal of Informatics, and they have quite a few very interesting articles as well.